In this video, we're going to be assessing the 12 cranial nerves along with deep tendon reflexes for a neurological assessment. So we're going to start by assessing cranial nerve 1, or the olfactory nerve. I'm going to have you occlude one nostril and smell. Okay, swap hands and occlude the other. Smell. And what does that smell like?
Lemons.
Very good. Okay. Next, we're going to assess cranial nerve 2, or the optic nerve. So I'm going to have you cover one eye for me. All right. And then I want you to look straight at me. I'm going to be moving my finger. I want you to say now whenever you see me wiggling it, okay?
Mm-hmm.
All right.
Now.
You have to look straight. Look straight. All right.
Now. Now. Now.
Okay. Same thing on the other side.
Now. 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 Now.
Okay, good. Next, we're going to do a bundle assessment of cranial nerve 3, which is your oculomotor, cranial nerve 4, which is your trochlear, and cranial nerve 6, which is abducens. So we're going to assess these by assessing the pupils, making sure they are round, equal, and reactive to light, and the same size on each side. So if you'll look at me, judging by my scale that I have here, I would say his pupils are about a 4. And I'm going to begin by shining my light. Look straight ahead. All right, his pupils are definitely Perla. Next, I want you to look into the distance for me. Look into the distance, and then look here. Okay, good. So I saw his pupils dilate when he looked off into the distance, and then constrict when he focused on an object up close, which is what we want to see. Next, I want you to do my cardinal eye movements. So what I want you to do is follow my finger with your eyes. All right. So his movement was symmetrical. He could complete all the cardinal eye movements. No irregularities there. So cranial nerve 5 is next on our list, which is the trigeminal nerve. So what I want you to do is close your eyes and I'm going to touch your face, and I want you to tell me when you feel it, okay?
Yep. 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 Yep.
Okay, and the sensation was equal on both sides?
Yep.
Okay, good. Next is cranial nerve 7, or the facial nerve. I want you to close your eyes really tight for me. Squeeze them. Good. Raise your eyebrows. Good, and then smile. Okay, so all his movements were symmetrical, which is good. You would not want to see asymmetry on that. Next is cranial nerve 8, or acoustic nerve. If I can have you stand up right here real quick, right in front of me. And let's face this way. A little more. I want to cover this ear, cover that ear for me. And I'm going to whisper a phrase, and I want you to repeat it, okay? Say what you heard.
I love you.
Good. All right, cover this ear. I'm going to say another one over here.
How are you?
Good. Okay, you can have a seat again. All right. So, of course, with that assessment, you could see if the patient had any hearing impairment. He does do construction, so he hears a lot of saws and a lot of power tools. So that would be an important assessment for him going through life to make sure he's not having any hearing impairment. All right. Next is cranial nerve 9, which is glossopharyngeal, and cranial nerve 10, which is the vagus nerve. What I'm going to do is I'm going to have you open your mouth real wide for me and say ah, and I'm going to be making sure that your uvula on the south palate is moving upwards, okay? All right. Say ah. Good. That's what I saw. All right. Next is cranial nerve 11, which is the spinal accessory nerve. I want to place my hands on your shoulders, and I'm going to have you shrug, and I want to make sure it's symmetrical. All right, go ahead. Okay, good. It was symmetrical, and he was able to overcome my resistance that I placed. Next, we're going to do the last cranial nerve 12, which is the hypoglossal. I want you to stick your tongue out for me. Good, all right. No deviation to one side or the other, normal there. Okay, now we're gonna move on to, you can sit back, our deep tendon reflexes. We want to have a reflex which is graded at a +2 on both sides. That's considered a normal reflex. Obviously you would not want anything less or anything more. So we'll start by the brachioradialis. And I'm gonna be using my stethoscope to elicit a reflex. So I want you to relax this hand down, okay? All right. Okay, that was about a +2. Same thing over here. Relax this hand. Good, so just a slight movement there. All right, next we'll do the bicep. So I'm gonna hold your arm out here. Good. On this side. Relax it. All right, and now the tricep. So now I'm gonna hold your arm like this, and I want you to relax it. You can sit up if you need. Okay. Just relax it, let the weight of it be on my hand. Not much of one there. Same thing over here. Okay. Same thing on that side, not much of one. Now we're gonna move to the patellar reflex. If you'll just relax these legs for me. Pretty good reflex there. Okay. Now if you'll hand me your feet, okay. I'm gonna rotate the hip outward and we're gonna test the Achilles. So I'm gonna kind of hold here on the foot. Good. Okay, other one. Relax it. Okay, good there as well. That concludes our neurological assessment.